Hello everybody, Dr. Carlo Ojed with DrER.tv. Of course, if you're watching this video, you are at ED Exit Video Pro. This is the healthcare version of Dr. ER.tv. This is for people interested in medicine or actually going through medicine. They want to learn about cases and interpretations on lifestyle. This is where you go to become a better provider. Today we're going to have a cool case. This is a 54-year-old woman who presented to the emergency department complaining of severe back and left shoulder pain. She has a history of metastatic non-small cell lung cancer, refractory to radiation. That means it didn't treat well with radiation and chemotherapy. She was in moderate distress. She was breathing fast, tachypnic. She was tachycardic, heart rate's fast. She was diaphoretic, which means she was sweaty. Her physical examination demonstrated ipsilateral means same side, eyelid ptosis. Ptosis means the eyelids fallen down. And pupillary MIOSIS, that means the pupils were small. Along with left-sided facial ANHIDROSIS, that means the lack of sweating. ANHIDROSIS, which was profound in comparison to the diaphoresis observed on the rest of the body. That means she was sweating everywhere but the left side of her face. The patient had recent outpatient positron emission tomography, PET, and computed tomography scan performed, and we're going to see those soon. You can see the sweats here and here and here, and nothing in this side. You can see the pupil here, smaller than this one here, and you can see that the eyelid is lower on this side than it is on the other side. So anhidrosis, ptosis, and meiosis. It doesn't get any more classic than that right there. Next picture is the PET scan showing unfortunate cancer, and you can see the small lung cell carcinoma at the top of her lung, obviously causing the pain going into her shoulder area. This is why she's hurting so much on that side. So, what are we talking about here? We are talking about Horner syndrome as a result of a Pancose tumor. So, two big names that you ought to know if you're in medicine: Horner syndrome and Pancose tumor. The superior pulmonary sulcus tumor was first described by Pancose in 1932 as characterized by Horner syndrome, which is pain and body destruction. These tumors are non-small cell carcinomas that progress to involve the surrounding bony, vascular, and neural structure of the apex of the lung. They often extend into the thoracic inlet, leading to shoulder and arm pain because of impingement of CA through T1 nerve roots. As these tumors invade the cervical sympathetic plexus adjacent to the trachea, they also produce a group of findings classically known as Horner syndrome, which consists of, and this is where you got to memorize this, ptosis, meiosis, anhidrosis on the same side of the lesion. So, ptosis, meiosis, anhidrosis. Go ahead, say it with me. Ptosis, meiosis, anhidrosis. And I'm probably pronouncing that wrong, but you get the gist of it. So, Horner syndromes. The patient displays all of these classic findings as non-small cell pulmonary sulcus tumors and the clinical triad of Horner syndrome. She had observed left eyelid droop, and her primary physician had commented on her left fixed pupil as soon after her original diagnosis. The anhidrosis was made prominent by her distress. On this visit, she was admitted for pain control, discharged to outpatient hospice, and died soon after. Now, that's a sad story. It really is. But the important thing is of knowing these things. If you see Horner syndrome, it's usually the result of a Pancose tumor, a tumor in the upper part causing claudication and causing nerve injury and impingement. We'll talk about that because at the apex of the lung, an impingement on CA through T1. And you have to know Horner's syndrome, ptosis, meiosis, anhidrosis. So this is what you got to learn today. This is the picture you got to lock in your mind so that if you see a patient with ptosis, meiosis, and they might have sweating on one side, not the other, you gotta think looking for a Pancose tumor and cancer, and then begin chemotherapy, radiation, do a PET scan, CT scans, and everything else. Hey, I hope you learned something today. I certainly refreshed on a lot of technical terms I haven't for a while. So stay tuned for our next video coming up soon, and let me know how you're liking this set of videos. Thank you so much, and we'll see you next time.